Another day, another story. Diabetes mellitus, often known simply as diabetes, is a group of common endocrine diseases characterized by sustained high blood sugar levels. Diabetes is due to either the pancreas not producing enough insulin, or the cells of the body becoming unresponsive to the hormone's effects. Classic symptoms include thirst, polyuria, weight loss, and blurred vision. Welcome to Tabo Eminent Channel. If left untreated, the disease can lead to various health complications, including disorders of the cardiovascular system, eye, kidney, and nerves. Untreated or poorly treated diabetes accounts for approximately 1.5 million deaths every year. The major types of diabetes are type 1 and type 2, though other forms also exist. The most common treatment for type 1 is insulin replacement therapy, insulin injections, while anti-diabetic medications, such as metformin and semaglutide, and lifestyle modifications can be used to manage type 2. Gestational diabetes, a form that arises during pregnancy in some women, normally resolves shortly after delivery. As of 2021, an estimated 537 million people had diabetes worldwide, accounting for 10.5% of the adult population, with type 2 making up about 90% of all cases. It is estimated that by 2045, approximately 783 million adults, or 1 in 8, will be living with diabetes, representing a 46% increase from the current figures. The prevalence of the disease continues to increase, most dramatically in low and middle-income nations. Rates are similar in women and men, with diabetes being the seventh leading cause of death globally. The global expenditure on diabetes-related healthcare is an estimated $760 billion a year. The story of diabetes is a complex one that involves historical discoveries, scientific advancements, and ongoing efforts to understand and manage the condition. Here's a brief overview of the history and progression of our understanding of diabetes. Ancient observations, 1500 BCE 100 CE. Ancient civilizations, including the Egyptians and Indians, noticed symptoms consistent with diabetes but did not fully understand the condition. The term, diabetes, is derived from the Greek word meaning, siphon, reflecting the frequent urination characteristic of the disease. Identification of diabetes mellitus, 17th century. In the 17th century, the term, diabetes mellitus, was coined by English physician Thomas Willis, who noted the sweet taste of urine in people with the condition. Discovery of insulin, 1921. The breakthrough moment in diabetes history occurred in 1921 when Canadian researchers Sir Frederick Banting and Charles Best, along with their colleagues, discovered insulin. Insulin, a hormone produced by the pancreas, regulates blood sugar levels. The discovery of insulin revolutionized the treatment of diabetes and saved countless lives. Introduction of insulin therapy, 1922. The first successful clinical use of insulin occurred in 1922 when a young boy with type 1 diabetes was treated with insulin extracted from animal pancreases. Differentiating type 1 and type 2 diabetes, 20th century. In the mid-20th century, researchers began to distinguish between type 1 diabetes, an autoimmune condition where the body attacks its insulin-producing cells, and type 2 diabetes, characterized by insulin resistance. Advancements in diabetes medications, 1950s onward. The development of oral medications to manage diabetes began in the 1950s with the introduction of drugs like sulfonylureas. Over the years, various classes of medications, including biguanides and thiazolidinediones, were introduced to help control blood sugar levels. Technological advances, late 20th century onward. Blood glucose monitoring devices, insulin pumps, and continuous glucose monitoring, CGM, systems have become integral in diabetes management. Research into artificial pancreas systems and closed-loop insulin delivery continues to advance. Genetic and environmental factors, current understanding. Scientists have identified genetic factors that contribute to diabetes susceptibility. Lifestyle factors, such as poor diet and lack of physical activity, also play a significant role in the development of type 2 diabetes. Global impact and awareness, 21st century. Diabetes has become a global health concern with increasing prevalence. Awareness campaigns, education, and advocacy efforts aim to improve early diagnosis and promote lifestyle changes. Diabetes remains a major public health challenge, but ongoing research, technological advancements, and improved treatment options continue to enhance the quality of life for individuals living with the condition. As our understanding deepens, the hope is to develop more effective prevention strategies and treatments for diabetes. Signs and symptoms. The classic symptoms of untreated diabetes are polyuria, thirst, and weight loss. Several other non-specific signs and symptoms may also occur, including fatigue, blurred vision, and genital itchiness due to Candida infection. About half of affected individuals may also be asymptomatic. Type 1 presents abruptly following a preclinical phase, while Type 2 has a more insidious onset. Patients may remain asymptomatic for many years. Diabetic ketoacidosis is a medical emergency that occurs most commonly in Type 1, but may also occur in Type 2 if it has been long-standing or if the individual has significant beta cell dysfunction. Excessive production of ketone bodies leads to signs and symptoms including nausea, vomiting, abdominal pain, the smell of acetone in the breath, deep breathing known as Kussmaul breathing, and in severe cases decreased level of consciousness. Hyperosmolar hyperglycemic state is another emergency characterized by dehydration secondary to severe hyperglycemia, with resultant hypernatremia leading to an altered mental state and possibly coma. Long-term complications. The major long-term complications of diabetes relate to damage to blood vessels at both macrovascular and microvascular levels. Diabetes doubles the risk of cardiovascular disease, and about 75% of deaths in people with diabetes are due to coronary artery disease. Other macrovascular morbidities include stroke and peripheral artery disease. Microvascular disease affects the eyes, kidneys, and nerves. Damage to the retina, known as diabetic retinopathy, is the most common cause of blindness in people of working age. The eyes can also be affected in other ways, including development of cataract and glaucoma. It is recommended that people with diabetes visit an optometrist or ophthalmologist once a year. Diagnosis. A positive result, in the absence of unequivocal high blood sugar, should be confirmed by a repeat of any of the above methods on a different day. It is preferable to measure a fasting glucose level because of the ease of measurement and the considerable time commitment of formal glucose tolerance testing, which takes 2 hours to complete and offers no prognostic advantage over the fasting test. According to the current definition, 2 fasting glucose measurements at or above 7.0 mmol/L, 126 mg per deciliter, is considered diagnostic for diabetes mellitus. Prevention. There is no known preventive measure for Type 1 diabetes. 2. However, islet autoimmunity and multiple antibodies can be a strong predictor of the onset of Type 1 diabetes. Type 2 diabetes, which accounts for 85 to 90% of all cases worldwide, can often be prevented or delayed. 86. By maintaining a normal body weight, engaging in physical activity, and eating a healthy diet. Higher levels of physical activity, more than 90 minutes per day, reduce the risk of diabetes by 28%. Dietary changes known to be effective in helping to prevent diabetes include maintaining a diet rich in whole grains and fiber, and choosing good fats, such as the polyunsaturated fats found in nuts, vegetable oils, and fish. 88. Limiting sugary beverages and eating less red meat and other sources of saturated fat can also help prevent diabetes. Tobacco smoking is also associated with an increased risk of diabetes and its complications, so smoking cessation can be an important preventive measure as well. Thanks for watching. Request you to subscribe the channel.